Hi everyone, my name is Dr. Zainab Hussain and I'm a GP in Stoke-on-Trent, and I wanted to do a video today about breast cancer screening but also breast cancer symptoms, because as a female GP I see a lot of female patients and sometimes I get asked questions on what are the symptoms of breast cancer, and also with regards to the breast cancer screening, what is it, what happens, do I need to be worried or scared? And I just want to say, no, you don't need to be scared, and I'll talk you through it now. So firstly, just want to say the breast cancer is the most common cancer in females. And so we're very lucky to have this breast cancer screening because it has the ability to pick up and sensitivity to pick up any small evidence of cancer that could be happening in your breast. So it's offered to women between the ages of 50 and 71, and you're invited, those women are invited every 3 years. And the screening appointment itself takes about 30 minutes, and a few of those minutes are taken for the actual x-rays of the breast, which is the mammogram. And so there's two x-rays of the left breast, 2 x-rays of the right breast, and that's it. The rest of the appointment is taken up by maybe the questions they need to ask you beforehand and talk you through what's going to happen. So it's very much about trying to make you feel comfortable, answering your questions. It's only females that are doing it, so you definitely shouldn't be worried. And then the results will come back to you via post. If there's anything on the breast, then you will be contacted. But if not, you'll just be re-invited 3 years later. In terms of symptoms, now breast cancer symptoms, most women know if you feel a lump in your breast, that's when you need to see the GP. Absolutely. But one thing I'm going to say is that it's really important to regularly examine yourself, regularly examine your breast, because you then get to know yourself, you get to know your breast, and then if there is any change, you can say, listen, this is not normal for me, I need to further tests or whatever. But lump is the biggest sign. If you have a lump in your breast or in your axilla, so in your underarm on either side, and that's really important to get checked, okay, by the GP. If you feel that there's any changes to the skin around on the breast, or it looks like a peau d'orange kind of texture. We call it peau d'orange because it's like, the outside of an orange, that kind of texture, the skin change, that's really important to get checked. If your nipple looks different, so if it's gone inside, like something's pulling it in, that's really important to get checked as well. Or if you have any discharge from the nipple, that's really important to check as well. There's a variety of symptoms that you need to look out for. One of the other symptoms, as someone mentioned, was pain. Don't necessarily get pain with breast cancer, but I would say if you are having pain that doesn't feel normal for you, I would definitely get it checked out. But obviously, just make sure the pain isn't changing, or, because it could be to do with your cycle, or could be to do with your an ill-fitted bra, for example. So those are the kind of symptoms you need to look out for. But all I want to say is the breast cancer screening is a fantastic, absolutely fantastic screening program. And it definitely has evidence that it saves lives. And so, it has saved lives, and we can save more lives. So if anyone will benefit from this video to attend the screening, please share it. I just hope that if you are eligible and you've been invited, definitely go. But yeah, thank you so much for listening to my video. I hope it's been useful. Okay, bye.